of information and new terms floating around like social distancing that are out, and we would know that you may have some questions of us. We have the local experts gathered right here for you, so please jump online and join us in the conversation. Beginning today is Dr. Haidar, again, an infectious disease physician. Infections such as this virus are what he specializes in diagnosing and treating. We're going to start with Dr. Haidar, who leads our infectious disease services team. Dr. Haidar.
Good afternoon. So first thing we're going to talk about is what is this COVID-19 and what does it cause, what symptoms should we look for, and how to stay safe. Historically, coronavirus is something we knew about since the early 1970s, and every few years it keeps changing. And we've had SARS before, MERS before, and most recently this COVID-19 that we're dealing with. Actually, COVID-19 is the name of this syndrome that the coronavirus presents. And this syndrome has multiple symptoms. We're going to talk about it a little bit in more details because it's very important for the public to know what are these symptoms and what to look for and go from there. So this is a virus that comes in through small droplets into our airways, and it attaches to special cells and receptors in our lungs. Once it does that, it starts causing fevers, fatigue. People are very tired. They just have no energy. Then they start having shortness of breath, some dry cough, and sometimes pleuritic chest pain, otherwise chest pain that increases and decreases with breathing and movement of the muscles. So these are the symptoms to look for. Really, all the studies that we've seen from China, from Italy, from all these places, not much upper respiratory infection. So we don't see much sinus drainage, ear infection, conjunctivitis. These symptoms really don't happen as much. So if we are looking at upper respiratory symptoms, usually this is probably not the COVID-19 syndrome. So as I was saying earlier, it gets transmitted via droplets. That means if I breathe or cough or sneeze, these virus droplets are in the air, and if I'm close to someone and they're breathing, they can take in these virus particles and I will get infected that way. Sadly, the other thing is these virus particles can stay on surfaces for quite some time. So if I cough in my hand and I touch a high traffic surface, or any surface in a matter of fact, if I touch a doorknob or press an elevator button, these virus particles can stay there for hours and sometimes even a day or two. And if someone else comes, touches the same surface and does not do proper hygiene and touches their face, their eye, their nose, their mouth, they can get the virus in that way as well. Another topic that I think is very important for the public to know is what we call the incubation period. Because there are a lot of patients and in the public that are freaking out about exposure back in February, or maybe they were somewhere 4 or 5 weeks ago. Incubation period is important because what happens is the average symptoms start showing up about 4.7 to 5 days after being exposed to someone with the coronavirus. And if that happens, it can be up to 14 days. But if it's more than 14 days, the incubation period has gone, and there's an unlikely chance that somebody will get infected. Once the symptoms start, they can move much faster than we are expecting with flu or other respiratory infections. Symptoms can deteriorate much faster. And sometimes people that have minimal symptoms or no symptoms at all can still have the virus, and they can still shed the virus. That means transmit the virus to people around them. I think that covers really the gist of the medical information that the public needs to know. So really, even people with minimal symptoms that they feel, oh, I just don't feel good, low-grade fever, I'm tired, maybe it's stress-related, maybe this is a mild presentation of the COVID-19 syndrome.
Thank you, Dr. Hyder. I appreciate it.
No problem.
We are starting to receive some questions. We can complete the intro portion of this, and then I will begin to go ahead and address the questions individually. So thank you for those submissions. Again, if you're signing on late, please enable yourself to submit questions by logging into your YouTube account or going to Adina's Facebook page. Thank you. Next, we have Dr. Christopher Brown and Ben are with us from the Ross County Health Department, which is working closely with the Ohio Department of Health to stay abreast of what's happening, not only in our region, but across the state. Gentlemen, if you could go ahead and begin your portion of the intro.
Thank you. I'm going to start out with some of the statistics. Nationwide, we're seeing 49 out of 50 states report cases of coronavirus. Here locally in the United States, there have been 3,487 confirmed cases with 68 deaths nationwide. In Ohio, we see 50 confirmed cases in 12 counties, and there have been 14 hospitalizations. I'm not aware of any deaths at this time in Ohio. Please keep in mind that this data is from yesterday, so these cases could be climbing as we speak. In terms of the counties, a lot of the counties in Ohio that are reporting cases are in northern Ohio, but we have seen cases in Franklin, Belmont, and Butler counties, so they are starting to show up a little south of the northern part of the state.
And in terms of how we're promoting people deal with this particular virus, we'll introduce that, or reintroduce, I guess, the term social distancing. And this is a public health concept that is designed to reduce the spread of this virus. It's actually based out of there was a big flu back in 1918. And so the concept is that we want to slow the spread of the disease. And the way we do this is, number one, social distancing, and this is where you keep a certain distance away from other individuals, as we've got here. And then also we want to reduce the opportunity for multiple people to be in the same space at the same time. And that is why a lot of the sports games have been canceled. Also here in Ohio, of course, initially there was the governor had expressed it. He wanted no gatherings larger than 100. And then most recently, we actually heard from our national administration that we want no gatherings greater than 10. And the idea is that we can slow the spread of this disease in order to not overwhelm the capacity of the hospital systems.
Thank you, gentlemen. Next we have Amy Robertson. She is Director of Quality and Infection Prevention and Safety. Infectious diseases are with us every day, and Adina's infection prevention team is always working to keep patients safe, along with staff and the community. Amy will profile for us some of these efforts at preventing the spread of this infection here.
Sure. So I just
Amy.
wanted to cover some basic infection prevention measures. And as you heard my partners talk about social distancing, which is so important and 6 feet away. Washing your hands, can't stress that enough. That is with soap and water or alcohol-based hand rub for at least 20 seconds. Cover your cough always. Stay home when you're sick. Don't touch your hands with your face, and that's very hard for most of us to do as we become more aware of that. Call your doctor before you come into to be seen. Let's see, clean surfaces, as Dr. Hadar said, those viruses can live on surfaces, high-touch surfaces, door handles and handrails, things like that. Avoid shaking hands right now because, again, that's just another way of transmission. And those are really the main things that I wanted to cover now.
Thank you, Amy. We appreciate that. Next, we have Kathy Edrington, Adina's Chief Operating Officer. She's here to talk to us about how we are preparing here at Adina Health for this. Adina Health System covers a 9-county service area of South Central and Southern Ohio. We're responsible for the health of more than 400,000 people. And there are a lot of aspects that go into executing on that on a good day. Ms. Edrington, what are the threats of coronavirus creeping ever closer to our region? How is Adina preparing for this?
Thank you, Dr. Tucker. We're working very hard here at Adina to make sure that both our employees and our community have the highest health possible. And in order to do that, we had to institute our emergency preparedness last week, just like the rest of the country, and have done a great job with that so far. We have put a lot in place operationally to ensure that our employees are safe and our patients are safe during this time. One of the things that we've done is we've put some visitor restrictions in place, which you all will see will evolve as days come. And so at our critical access hospitals and our cancer center, right now we do have strict visitation for the clinical areas there. Here at ARMC, we are allowing one visitor with patients. However, that is going to change in the coming days as we start strict screening of both visitors and employees as they come in. We've also put a COVID-19 clinic in place that went live this Monday. This is a great place for us to filter all of these patients that may have symptoms or meet the criteria to be screened. That way we don't have lots of patients coming into a lot of different places in our health system. In addition, we've put a screening or triage hotline in place, and that will allow for people to call in. And we encourage you, if you feel like you're at risk, to use that hotline and stay away from the health system unless you are told that you need to come here. However, we have had lots of questions around whether or not you should continue to use our emergency services and our urgent care. And yes, you should. If you have a medical reason that you need to come to the hospital, we encourage you to come to get that care. However, if it does go in line with a respiratory infection or the concern that you might have COVID-19, we want to make sure that you call that number and get screened first before you come to the health system. So we want to also let you all know that we're working very much so in this health system around opportunities for our providers to provide some telehealth visits. That way you can continue to have care that's necessary. So you'll be hearing more from the health system around that.
Thank you, Kathy. So at this portion, we have concluded at least our introductions. I'd like to go ahead and begin by responding to some of the questions that are being submitted online. Again, just to echo that, if you are now watching, you can submit questions by logging into your YouTube channel or on Adina's Facebook page. One of the first questions I have here is, do we have test kits locally? So I'm going to go ahead and field that one. Dr. Haidar and Amy are welcome to jump in as well. What we do have locally is the ability to collect a nasal or oropharyngeal specimen, meaning we can collect a sample from the nose or the back of the throat. Processing of this kit does require us to send it to outside labs. At this point, the health system or hospital does not possess within its lab the ability to process the kit. So we collect the sample according to very strict state guidelines on who should be tested, and then send that sample off generally to Columbus for processing, and they report back to us on the results. Unfortunately, where we are at as a state, as a nation, and as a local health system is that we are still facing an extreme shortage of the ability to process these test kits. As of yesterday, I had 170 samples that I could swab symptomatic patients for, but was informed this morning by one of the independent private labs that they are running out of testing reagents. So we're making changes almost hourly within the health system of how we prepare to deal with this, even if we're faced with a challenge of running out of testing kits. Dr. Haidar, anything else to add to that?
Yeah, I would like to also say that this is across Ohio. I think Cleveland Clinic is the only one that is doing in-house testing at this time. So all the other hospitals in the area have to take the specimen and send it to ODH or an independent lab. So this is not exclusive to Adina, that we have to send it out of the facility to get tested.
Amy, anything to add to that?
Nothing to add.
Okay. The next question I have is Adina giving masks to all, I assume, patients who are entering our emergency department. At this time, the answer is no. It's very important for the public and community to understand that there is a very large threat right now of limited supplies of what we call PPE, personal protective equipment. This is equipment that healthcare workers wear in order to prevent the transmission of contagious disease from one person to another. At this point in time, we're looking at not only statewide, but nationwide critical shortages of PPE, which includes masks, gloves, and gowns. Any patient entering the emergency department with signs or symptoms that could suggest a contagious respiratory viral illness are being placed in a surgical mask, which is the only known protective measure as recommended by the CDC to prevent transmission. Staff within the emergency department will be wearing appropriate PPE as they assess these patients, again, as designated by the federal government. But no, at this point in time, we do not have the capacity to hand out masks to all patients that are entering the emergency department. Amy, I suspect you can add to that.
That we have cough etiquette stations at every main entrance of the hospital and waiting areas. If you have respiratory symptoms, you can certainly ask somebody that's sitting there. We usually have security or volunteers for a mask that you could wear for that reason. But like Dr. Tucker said, you know, we are seeing a national shortage with PPE. So right now we are doing some conservation measures.
Just so that everybody can understand the magnitude of the potential shortage, it is estimated that the requirement or of the needed PPE for Ohio alone is more than is possessed right now than in the entire nation. So this is something that we have to make very critical decisions about and make sure that all PPE is deployed very judiciously. If we run out before this pandemic local outbreak hits its peak, we're going to be in serious trouble. So we're making very hard decisions now regarding the use of masks. This is another great question. Oh, go ahead. Sure, absolutely.
So it's crucial that the public knows that we need to ration, and if somebody has respiratory symptoms and they are concerned and they need to be isolated, they should let us know. But if somebody comes in after a broken ankle from an accident or whatnot, then they don't need to. So we really need our patients to speak up as well and say, hey, I'm having fevers, I'm coughing, and I need a mask, versus a different patient that requires it less often. So even though we're rationing, we're still, I think, using it in all the appropriate places and the appropriate times.
Excellent point. Thanks, Dr. Haidar. The next question, does Adina have any pending tests for COVID-19 or coronavirus? Amy, I'll let you take this one.
We have pending, I'm not sure right now exactly, because we were trying to outsource to another company. So like Dr. Tucker said, ODH has some really strict guidelines on who they're going to test. Even if we would collect it, it could possibly be rejected at this point. We've had 4 inpatients with no positive testing at this point.
The best news I can say is we work with our lab company is telling us that maybe in the next 2 weeks we'll be able to hopefully do the testing in-house, BioFire. So that's what the projection is. Now, again, all these projections that we are expecting, sometimes they're not going through because the problem seems to escalate in multiple states, and the labs are running out of reagents. But that's hopefully where we're heading.
Thanks, Dr. Haidar.
I can speak for Ross County, and we have had 2 PUIs, persons under investigation in Ross County. One of them did test negative, and the other one is still at ODH. This is just Ross County residents.
Yes, that's my understanding. So just to summarize very quickly, because I do think that's important, we have tested 4 inpatients, people sick enough to be admitted to the hospital for this virus. All 4 of those tests are negative. So to date, we do not have any positive tests here at Adina Health System. I do believe a few are out, though. Next question is a great one. This one is, what is are the maximum number of ICU beds Adina can provide for? And I will kind of help augment that question. Let's also address the number of ventilators, meaning the machines that we can use to breathe for patients who get so sick that they stop breathing. So, Kathy, if you can take that.
Yes, so our ICU unit is 12 beds. However, we do have other spaces in the hospital that can be utilized for the ICU. We have units that have already been outfitted for ICU. I think people need to remember that when it comes to an ICU patient, it is around the equipment and not really the geographic location, but the competency of the nurse matched to the needs of that patient. So we are nimble there, and we can make adjustments that we have to make. But to Dr. Tucker's point, the issue then becomes equipment. So I'll let him talk a little bit about that.
Specific to the equipment, as I mentioned, it's actually the number of ventilators that's most important. We can ventilate somebody in a hallway if we have to. The two most important pieces there are the ventilator and the nurse that is trained to deal with a patient that is that ill. At this point in time, Adina has 19 ventilators prepared for use if need be. I am reaching out to other local health systems, including the VA, to determine their counts and capabilities. We are already thinking about backup possibilities, meaning if we've got 19 patients requiring ventilation, what else can we use in order to help breathe for patients? And that would include things such as anesthesia machines. What are called BiPAP machines can also be used as pumps. And then if need be, we can do literally mechanical hand ventilation using the bag and bag valve masks. Certainly we hope we don't get there. The importance of the community following these guidelines for isolation, meaning not leaving your homes unless you absolutely have to. This concept is one in which the more aggressive we are at doing that and following those rules, the lower the peak of the curve will be, the less severe this outbreak will be locally, hopefully then allowing for the health system to be able to care for everybody who presents with it. If we do nothing and this thing spreads like a wildfire, thus presenting dozens and dozens of patients to our floors, overwhelming our ability to ventilate them, that's when terrible decisions have to be made about rationing health care and prioritization. We don't want to get to that, so that's why I want all of you listening today to spread the message that staying home when you don't have to be out and about is terribly, terribly important. And it's not just for senior citizens. The reason that schools have been canceled is because schools and children are a very common source of spread of highly contagious viral infections such as this. Yes, a child might not be likely to pass from this condition, but somebody who they spread it to very well might.
One of the things that we're doing also operationally is we are making changes to our procedural areas and our operating room areas, and making sure that those elective cases are being held off so that we have access to that personal protective equipment and the other equipment that would be needed to take care of patients who come in with this virus.
Dr. Haidar, anything else?
Yes. So we expect COVID-19 to be among us, and we do have limited beds and ICU beds and ventilators. But I would like the public to know that over 95% of the population that is infected with COVID-19 hopefully will not need to be intubated, or it doesn't get to that point. All the numbers that we're seeing is about 90% of the population with COVID-19 can be treated at home, and they don't need hospital stay. So also, that's another thing. I want to make sure that people know that having COVID-19 does not mean I have to go to the hospital and get admitted. Mm-hmm. That is very crucial for everyone to understand that.
Excellent point. Amy, anything to add?
No, just echoing that. Okay. If you normally would not seek health care for a cough, cold, sniffles, you just want tested for that and run through the screening process. First utilize our triage line and then our COVID clinic.
Excellent points. Next question is, today it was noted that pregnant women are now at high risk. What are the recommendations for pregnant women? At this point, I'll let Dr. Haidar.
The recommendations for everyone is the same. The best way to deal with all of this COVID-19 is basically not get infected. And the way you don't get infected is social distancing, washing your hands properly, that means 20 seconds, and really minimizing touching surfaces and going out. Again, that's the only best way is preventative measures. So whether you're pregnant or you're elderly or you have comorbid conditions, please, everybody needs to understand that we need to try to avoid getting infected. And really, that's all I can say at this point.
It is not my understanding, and Dr. Haidar and I have looked at a lot of information regarding these infections and what it looks like. It's not my understanding to date that pregnant women are in the group that's likely to progress to becoming severely ill or dying. At this point, the groups that appear to be most at risk are the elderly, and again, they're defining this as folks 60 and over, and those also that are elderly with chronic medical problems, things such as emphysema or heart failure. Heart or lung disease is really the ones that are probably most problematic. So for a young female who's pregnant, I would not necessarily be worrying myself terribly, other than following the very astute guidelines put out there to stay inside, wash your hands, stay away from the sick folks, and such.
I believe the median age right now in Ohio is 51 for the positive cases.
Median age, meaning that for right in the middle, if you look at all of the folks that have gotten it, if you look right down kind of the middle of it, not necessarily the average, but it's around 51. My understanding also is, as far as mortality, those folks that get it, are test confirmed and die, is much closer to 80.
Correct.
If I'm not mistaken. So that, I think that's kind of helps you to understand those likely to be most at risk. The next question is COVID-19 or this coronavirus considered an airborne virus? And this is Dr. Haidar's.
That's an excellent question. The answer is no. It's actually what we call a droplet virus. That means airborne viruses are viruses that are so small that when you cough, they can be in the air for hours after. Things like measles is airborne. The COVID-19 is a heavier, bigger virus. That means if you cough it, eventually it will fall with gravity to the floor, and hence the 6 feet distance is really enough. If you're further than 6 feet, it's very hard to get the viral infection. So the answer is it's not airborne, it's droplet. But we're still having to use airborne and droplet isolation in the hospital. And I don't know if that will change with the CDC recommendations.
As well as contact and standard.
Well, yeah.
They pretty much put every
Right,
kind
I'm
on
just
it.
talking to the public, not to the... So yes, we are basically airborne contact. We're wearing the gowns, the face shields, everything. But by definition, this is a droplet virus. That means it doesn't stay in the air. If you've been to a room where somebody was in 20 minutes ago and coughed, you're not going to get the virus by breathing the air.
Excellent, thank you. This one's going to be for Amy, and this is the one that we've been working with really now over the last 10 days. What are the criteria that must be met in order for a patient to be tested for COVID-19?
Okay, well, I'll ask Dr. Haidar to partner with me on this because there are 3 different scenarios, correct, as far as ODH goes. So I'll let you go ahead and speak to that and the specifics of it.
Sure. So we would love to test as many people as we can if we can, but we don't have the kits, and we have to stick to what ODH dictates that we do. That means even if we feel that this patient really, I feel that is high risk, I need to test, if we don't follow their algorithm, they will just reject the specimen. So we're basically having to really abide by the ODH recommendations. And at this point, this is something that is changing every day. At this point, the only people that need to be tested are either patients that are sick, so they have to have fevers and or they have to have the lower respiratory symptoms that we talked about earlier. That mean cough, shortness of breath, and chest pain. If they have these and they have been in contact with somebody that is COVID-19 positive, or if they come from a high endemic area, and at this point we're only talking outside of the US, including Italy, China, etc., then we can test them. The specimen will get accepted at ODH. The other, so that's one part. The second part is if somebody doesn't meet all these criteria, have respiratory infection, has fever, no contacts, but they're deteriorating and their lungs are doing much worse and they require a ventilator. In these situations, we also can check for COVID-19. Other than that, really, most people, if they have some symptoms, just fever, they don't require hospitalization, no obvious sick contact, really, we would love to check, but we don't have the capacity and ODH will not do it.
And we're keeping up to date every day with those ODH updates. Really looking forward to some new guidance since we are seeing community transmission in Ohio. So every day we're just monitoring that and updating our processes to align. Did you all have anything from the health department perspective on that?
No, I don't think so. I think you covered it pretty well.
Thank you.
Exactly, yeah.
Thank you.
At this point, just to summarize, in order to get tested for this, under today's guidelines, you have to have symptoms, meaning if you don't have symptoms, there's no way at this point you can get a test. You have to have had symptoms and a high-risk travel history or had a contact with somebody that has had a known positive test. And again, you can see how hard it is to get the test.
And contact is not someone that you saw at a McDonald's. Contact is someone in close proximity, like you live with or you share a car with. So at this point, really, testing is mostly for patients that require hospitalization,
Yeah.
to summarize.
And that's how we're looking at it here at the health system. If you are sick enough to require admission, that, for us at least, pushes you up on the priority scale, and we do our best to try to get those folks tested. But again, that's a changing story daily. The next question we have, and I think Kathy can help me with this one, will outpatient offices be closed?
So we are evaluating that now. We talked a little bit about the fact that we were making changes with elective procedures, and so that will also affect some of our outpatient clinics and our outpatient settings. I can give you an example of one that we have closed. That's our cardiac cath lab, or our cardiac rehab has closed. So that is certainly something that we're evaluating every single day and working with our providers, and there will be more to come on that in the days to come.
Next question we have is, will you be screening people at the door and diverting potential COVID patients to a detached facility as some hospitals are doing? I'm going to go ahead and start the answer to this. That is what we actually are attempting to do by setting up, one, the triage line that's available, and then number two, the COVID clinic, which is detached from the main hospital and across the street. The idea with this is for both patients and primary care providers to contact this number to determine if a patient might meet the criteria for testing. If they do, and it appears they are symptomatic, then they, yes, are directed to this detached facility for further evaluation and to see again if they meet the criteria the state has put forth to proceed with testing. It's important to understand, though, that for most patients, if you would not normally seek health care for the nature of your symptoms, that it's very unlikely that you would come to this COVID clinic and end up being tested. It's very important for everyone to understand that most of the people with these symptoms are going to get better. They're going to get over them and be okay. That it's only people that are deteriorating, and the way that I would think about this is if you are struggling to breathe, if you're having shortness of breath or breathlessness that you don't normally have, and also have lower respiratory tract infection symptoms such as fever, cough, or the type of chest pain that Dr. Haidar described. With any of those, you actually do need an evaluation, and we would recommend that you call ahead and let the clinic know, call through the triage line, but they will let the clinic know you're coming for evaluation. If your shortness of breath is anything more than very mild, we actually are recommending that those patients present to the emergency department for further evaluation, as we understand that this COVID pandemic will occur amongst all of the other conditions which come at us this time of year, including influenza, bacterial pneumonia, heart attacks, heart failure, and whatnot. So it's important that if you're short of breath, that you seek out care, but if otherwise you would not call or come to a doctor for your symptoms, it probably is not beneficial for you to come out for evaluation or be tested. So, Kathy, anything you want to add to that?
Just that we will be tightening down on our screening, kind of like I talked about with the visitation and the fact that that's kind of evolving and ever changing. We will be doing the same thing with our screening, and we'll be screening folks that are coming in for visits, our visitors, as well as our own employees.
Okay. The next question is, as a caregiver, if I have a client show symptoms, what are the next steps that I should take? So this would be a good one for Amy. If she were running a primary care office and a patient walked in and said, hey, I'm here for my diabetes follow-up, but I am coughing and I think I have a fever.
First thing is source containment with a surgical mask for the patient. And then we would get them into a single room for isolation. And then they would contact the lead clinician within that department to do the assessment, use the proper PPE, and then we can triage that patient to where they need to go for whatever level of care is required.
Dr. Haidar, any further advice on that for a provider, a physician, or?
No, basically what Amy said. The best thing is if somebody's having symptoms, please call your provider before you go there and saying, hey, I'm here for a follow-up for my diabetes or whatnot, but I'm also having low-grade fever and I'm having a cough. So let them know ahead of time. That would be very helpful for your provider and for his staff and how to deal with the situation before you even get to the door.
Thank you. This is a great question. We are trying to self-isolate, but need to go out for supplies or make other errands. How can I protect myself when out on these errands?
So I think that for individuals that do need to go out, we are still recommending those same kind of public health items in terms of when you go into a store, like I said, a lot of times they will have areas where you can wipe down the handle for your grocery cart. You still want to maintain social distancing, so you want to make sure that you have some distance between you and other people that are there. You want to minimize touching other items while you're there. Get what you need to get, and then get out the store as quickly as possible, and then of course return back to your home. So the whole concept of this is we're really trying to minimize people being out in the public, and this goes especially for people that are in those higher risk groups. So the older you get, the less you want to be out. If you can find someone that can make that grocery run for you, that actually might be better than you going yourself.
Excellent advice. I would recommend, and I'll just make, let's say, a grocery run as an example. I would make it off hours. I would not make it during the middle of the day when I would anticipate a lot of other folks to be there, because you want the number of people in that store to be probably at its minimum. Certainly as I entered the store, I would be cautious about the door handle, the cart I was going to use. Make sure that if available, you use the wipes to wipe down the cart. If you have the portable hand sanitizer, that's another great one to be used frequently after contacting things such as the door handle. When you shop for your packages or produce, at this point in time, we do not believe that touching things like an apple or a package that's on the shelf, a thing of paper towels is necessary, putting you at high risk of transmission. So you can shop for your groceries, get to the checkout, maintain that 6-foot distance at the checkout so the line might be stretched a little bit. Process your payment. Make your way out to the car to load your trunk with the bags, and then perform hand hygiene again before you touch your door handle and enter the car. Again, you want to shop in a very focused fashion, so have your list prepared so that you can walk in, get what you need, and get back home again safely. Other types of errands, like going to the bank, apply the same principles. Think about things such as high-touch surfaces, things like keypads or door handles, using a community pen at the bank, so to speak, and then being able to rapidly disinfect your hands. Generally, that's going to be portable sanitizer or something of that nature. If somebody gets coronavirus and recovers, can they get it again? I believe I know the answer to this question, but I'm going to defer to the expert here, Dr. Haidar, to answer that for me.
The answer is no. There have been a case or two in the literature about patients that have had coronavirus and then they were reinfected with the coronavirus. Again, coronavirus it's a spectrum of multiple. It's the same virus, but it has multiple genetic makeups. So they could be infected with a different coronavirus, which is the not a severe type, and it usually causes the upper respiratory infection, which is the runny nose, sore throat, etc. So, but the same COVID-19, for all sakes and purposes, out of 170,000 people worldwide that have been infected, there was a documentation of 1 or 2 cases that supposedly were reinfected, and it's not even verified. So the answer is no.
That was the answer I was thinking, so thank you, Dr. Hyder. He is the expert. Something else that I would think about this is there are other tests. The coronavirus, before this pandemic, a coronavirus caused SARS, if you're old enough to remember that, and another sort of less publicized event called MERS. But coronavirus, there are 4 relatively common forms that are very benign, and they cause the common cold, as Dr. Haidar was referencing. There is a test that's been run more recently by healthcare providers called a respiratory infection panel. This panel, when they swab you and test it, can, for most purposes, tell you exactly which virus you're infected with. It does not test for COVID-19. However, it does test for the virus, the coronavirus, that causes the common cold. So, if anybody in the community has gotten this particular respiratory infection panel and been told that they have coronavirus, it is not the syndrome that causes COVID-19. So that's just to put out there, because I've heard several instances of people getting this news and thinking that they're in trouble. Due to the strict testing requirements, what assumptions should we make about the possibility of the virus already being in the community? Okay.
We are taking our cue at the health department from the State Department of Health, and Dr. Acton, the director up there, has told us that the evidence that she has from the experts indicates that it is absolutely out there in the community right now. I think the delay in testing is likely the largest reason why we haven't seen that yet. Her estimate last week, based on certain math and models, she had predicted that 100,000 people in the state of Ohio might be walking around with this virus.
You might ask yourself, how would somebody be able to guess at such a number? This is based upon, there's a science called epidemiology, and it uses the behavior of previous outbreaks and infections to predict the behavior of future ones. So just as he said, they used calculations based upon other outbreaks and what we know of how many cases have tested positive so far, how quickly it's spreading, to estimate that it's possible 100,000 people across the state of Ohio have likely already been infected. Dr. Hyder, you want to add anything to that?
No, it's basically statistical analysis of models that have been tried and have proven to work. So these numbers are actually accurate.
I think some other modeling that's important that we understand is in terms of the peak of this virus. Dr. Acton is estimating that the peak will be sometime around the 1st of May or the end of April for peak numbers here in Ohio. Again, based on modeling, and it could change, but that's the best information that she has at this time.
Yes, the more information they do get from testing will help them determine a more accurate prediction here. So this question relates to the previous. Did our European neighbors have such strict testing requirements?
Well, I guess it depends on which. Europe is multiple nations, and each country has its own policies. The answer is no, they don't. They actually are more liberal in testing their population, and that's why they seem to have noticed a great surge in the numbers, not because there's a great surge, but because they're testing more and more people. I think the nation that did the best at this was South Korea. They were able to test significantly more patients and get much better results.
The nature of how well each individual nation does is in part based upon the timing of its response. I don't think there'll be any nation on the planet that is not subject to having developed a response to this. Those that have delayed significant action for too long, we see suffering some pretty bad consequences right now, such as what is being required in Italy and Spain. Europe has now been declared the worldwide epicenter of this epidemic. I think early on China was slow to respond, but then realized the implications of what they were dealing with. And as per their government's capability, again, much more centralized power, were able to respond to what appears to be adequately and bend the curve of how this virus is breaking out in their country. The United States, I think when this is all said and done, will be faulted for such challenges in the availability of testing. That being the case, and it's as I've directed the team this morning, we have to operate presuming that now this virus is here and that it's very likely people are showing up that are infected with it that we can't test for. And so we need to proceed in an extreme fashion and with great urgency in order to make sure that we here respond locally and meet the need. I can tell you one reassuring thing I heard is that it's likely this curve and peak are likely to be different in rural settings, such as we live in here in southern Ohio, versus very dense urban centers like San Francisco, Seattle, and New York City. Where we live will hopefully play to our advantage when it comes to how intensely we will be hit by this pandemic and what we have to deal with in the near future. This next one is actually a very important question, and we talk about it daily. What is Adina doing to train and prepare staff in the event of a large outbreak or nursing shortage? Kathy can help me handle that question.
Yes, so we've been evaluating that, and with the closure and the pause on some of our clinics and our procedural areas, our operating rooms, we're looking at all of the staff in those areas and evaluating competency across the organization and working through our clinical education department to ensure that we have good pools of nursing staff as well as support staff to help relieve people as this evolves. So yeah, we've really taken that seriously.
This also, I think, relates to a question that Dr. Hyder answered earlier about being able to get the virus twice. So one of the concepts that we are developing here is what I have kind of labeled provider recycling. What I mean by that is, let's say we've got a group of doctors at this table and half of us get coronavirus this week. We have symptoms. Let's say we could even test for it and confirm that that's what it is. Once we have recovered and are past the, let's say, quarantine period for active infectivity, meaning we can't give you the virus anymore, we are now prime candidates as frontline staff in areas where there would be risk of passing this on, meaning we technically can't get it twice. So we are kind of preparing with backup strategies and plans to use that to our advantage.
Oh, so we're not going to go on a cruise?
I'm not going to get this and go on a cruise, but that's an excellent suggestion. Maybe when it's all over. Many people out in public are currently wearing masks and gloves when they're out running errands. Is this necessary, or has it been shown to be effective? Amy, answer that one for us.
I would say no. No, because like we spoke about, source prevention, of course, if you have those symptoms, but you really shouldn't be out and about if you are sick. Like Dr. Tucker spoke about earlier, really need to be at home, be aware of your surroundings and the possibility of transmission. And again, just echoing that message that we are seeing PPE in high demand, and we need to save that PPE for our healthcare workers who are at the front lines, who are going to be, whenever this peaks and we see an influx of patients, that we need that to be safe to take care of these patients.
Thank you. We're now approaching, nearing the end of our session and our town hall for you. I'd like to ask Dr. Brown or Dr. Hyder if they'd like to add anything before I do the closing.
I would just like to say, from a public health perspective, we've talked about testing and things of this nature, and I think a lot of the anxiety about that, at least that I see about testing, is because I think people think that there is some sort of treatment for this, and there is no treatment for this particular virus. We have no treatment, we have no vaccines. So the way we're managing it, and we reiterated this several times during this program, is by these public health measures, where we're talking about that social distancing. And this is the reason why that social distancing is so important, because we know this is in the community. We don't know where. You can't see this virus. You can't feel it. There's no way to tell how it's going. But it's very important that you adhere to the advice from that all the healthcare people are telling you, because otherwise, if this does get out and if it does start to spread, we will not be able to. We may not be able, or we will stress the healthcare facilities that we have. So,
And just to back up on that, right now, the best public health advice for businesses and agencies outside of the healthcare system, obviously, is if you can afford to, or if it is possible, if it is reasonable, you probably need to limit access to your business or your agency. Now, I recognize that everybody can't do that, so the next best thing is going to be limiting the ways that the public can access your business or your agency, thereby protecting your employees, and then also limiting the spread in the community. So the health department's here to help you work with that, how that works for your agency or your business, so feel free to reach out to us.
Dr. Haidar?
I can't stress enough that, just to reiterate, I think the health minister of Germany said it, and he said, assume you have the virus, assume everybody else around you has the virus, and go about your life that way. That means stay away from people, use protection, really go for the essentials of life. It's not going to be fun for the next few weeks, but I think we all have the public and the moral responsibility to do the right thing, to flatten the curve that we keep talking about, and hopefully to go through this process with the least amount of problems and issues.
Thank you. I want to echo that from everyone. I keep walking around telling people what we are doing right now today is we are taking extreme measures to prevent what could be an extreme situation. So I plead with everybody that's watching to please heed the directions and the warning, to spread the news for us with your friends and neighbors, your Facebook contacts, that this principle of self-isolation is very, very, very important when it comes to the nation being able to tackle this situation and us coming out on the other side with minimal trauma. So please heed that warning and do the very best you can as individuals and families to self-isolate. One of the statistical things I find very fascinating is if today we started the entire nation were to all go back to our homes, everybody, except maybe the folks that keep the power on, the folks that have to come to the hospital to care for the sick and dying, everyone that wasn't essential were to go home and stay home for 2 straight weeks, it would be very likely that in 3 weeks this whole debacle would be over for the entire nation. So that goes to show the importance of how we all need to take this and take it very seriously. There's a lot of information out there. Some of it can be confusing and even misleading, depending upon your sources. We want you to get the facts, remain calm, and stay diligent with your health and safety efforts. To stay up to date with reliable information, we urge you to visit a number of sites, and that includes adena.org/COVID-19. If you go to adena.org, you will see the pop-up banner will guide you there if you click the button to follow it. rosscountyhealth.org, cdc.gov is the federal link, coronavirus.ohio.gov, or call 1-833-4-ASK-ODH, 1-833-4-ASK-ODH. We will provide links to these pages on our website at adena.org. Thank you for participating in today's discussion. and we plan to have another virtual town hall this coming Friday, March 20th at noon. We hope you'll join us then, and we hope everyone stays home and stays safe. Thank you very much.